Good afternoon. Barney Gomez, Chief Information Officer for the Department of Healthcare Services. As Renee indicated, the budget change proposals for the staff to basically to continue on with this workload. There's an interface that connects our system to the Affordable Care Act system, CalHERS. So as Renee indicated, we have to make changes on the the med system, the data repository side, whenever there are changes coming from CalHERS or there's legislative mandates, as well as our interface that connects the two systems together.
Okay, and then the next two questions deal with CalHERS and the 24-month roadmap. So the first question was to describe the most up-to-date version of the 24-month roadmap. So as you know, the 24-month roadmap has served as our overarching strategic and tactical document that helps to describe at a high level the changes that are needed both by the Department of Healthcare Services and Covered California in terms of initiatives and change requests that are planned for CalHERS in 2016 and 2017. The way the roadmap is currently laid out, it does identify changes that were being planned for releases in the latter part of 2016, as well as new initiatives that are being planned for 2017. We have been doing a lot of collaborative work with the with Office of Systems Integration as the project oversight, as well as with our county partners. And as we have structured ourselves in terms of our governance and looking at the system changes that are needed, we've kind of refocused what that 24-month roadmap looks like and looking at better ways in which we can outline what the changes are, what's forthcoming, and the timeframes in which those changes are going to be planned for in the coming year. So the way the 24-month roadmap currently is laid out, there are initiatives that are slated for 2017. We do have internal meetings that we host with ourselves, with Covered California, the project sponsors, and our county partners in terms of talking through what the changes are. As we land on what those needed changes are, then we look to populate the roadmap with those changes. So the most recent version that has been laid out does identify what the initiatives are for 2017, and we have now recently laid out what the actual changes are that are being planned for quarter number one. As we continue to meet through what we call summit meetings and discuss what the plan changes are specific to the initiative, then we'll identify what the specific changes are and then lay out those changes and then repost and have discussions with our stakeholder work groups in terms of the changes that are planned for the CalHERS and the roadmap that's before you. The next question that was asked is there an accessible, detailed accounting of all the ongoing difficulties with CalHERS, proposed solutions, and future planned improvements and timeline? Again, we do use the 24-month roadmap as a tool to help communicate what the future plan releases are and what their applicable timelines are. We do have project governance that's used to provide the executive direction and to provide project priorities, resolve problems and issues. And the governance structure that has been laid out under the direction of our project director is we have an executive steering committee. This is comprised of executive leadership from both Covered California, from DHCS, OSI, and from California Welfare Directors Association. We also have, and at that executive steering committee, that gives, the final say-so in terms of the direction and the changes that are needed through the CalHERS system and the changes that are planned for in the upcoming year. We also have a project steering committee, which is led by executive leadership within Covered California, DHCS, the Department of Social Services, and again with the County Welfare Directors Association and our project director. It's at that level where we work through issues that are identified in terms of the planning work and any identified issues with releases that come up and the changes and the priority setting for those releases for the CalHERS roadmap, for the 24-month roadmap. We also have a program coordination committee, and this is a committee that has representatives on it from the department, from Covered California, from Department of Social Services, the CalHERS project, as well as our county statewide automated welfare systems representatives. Those are the individuals that have lead over the 3 different county eligibility enrollment systems. They're all represented in those meetings, as well as with CWDA. And we use that forum to kind of do a deeper dive in terms of what some of the identified changes are and or issues with those proposed changes. And then to the extent that they cannot come to an agreement on the changes that are needed and kind of the planning for what's going to be coming forth in an initiative that's identified on the roadmap, that's then taken to the project steering committee. We'll work through whatever those issues may be in terms of the needed changes, and then to the extent that there may be some additional input that's required at the executive level, meaning from the director of the department at DHCS or from the executive director with Covered California, that is then taken to the executive steering committee. But we, throughout that process and those different governance structures that we have in place, those are the things that we use to help account for what the needed changes are, if there's any defects or anything like that that may result from the planning efforts that we have to undertake, and then for any defects or problems that may arise from the planning and the testing efforts, then we'll identify what that criteria may be, and then the changes that are needed, and then how we're going to plan to address those through the information that gets populated into our roadmap. And with that, if you have any questions, I welcome them.
Thank you. Is there anything from Finance? Anything from the LAO's office? Any committee member questions? Seeing none, any public comment?
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We think important progress has been made on Cal here since we stood before you and complained about things like pregnant women not getting into the right program and former foster youth not getting onto Medi-Cal. So we want to thank the department and the folks at Cal here for engaging with us. Advocates have done 3 different sessions of user acceptance testing. I actually got to go to Cal Here's last year and see the system for myself. Jessica Haspel, who's here, was just there this morning, and we'll talk about some of the findings from this morning. So some of the big eligibility problems that we did talk to you about last year, including pregnant women and former foster youth, important progress has been made, and we appreciate that. Finally, pregnant women are being determined eligible for the MCAP program. Former foster youth, if they have uncomplicated cases, are getting on right away. There are still some problems, and we would urge the department to really prioritize. We don't understand why some of these things that we had hoped would be fixed for former foster youth back in October still are not fixed today. We also appreciate that Cal Here's has issued an updated 24-month roadmap that goes through 2017. We agree with the priorities that are on that roadmap, although we have some concerns about the timing. One of the critical pieces in Cal Here's that we're still concerned about is just how you enter your income. You can go into the other category and enter categories of income that shouldn't be counted. So we know that a certain number of people are getting the wrong eligibility determinations for Medi-Cal and Covered California, and we are concerned about that. We know that there is a major, I forget what Ms. Malo called it, an initiative around income that's slated for March of 2017. We think that's not a moment too soon. Want to see if there's a possibility of moving that up, because, again, we're very concerned that some of the income is confusing. We're not explaining some of these very complicated tax terms and other issues to consumers. There are also still several problems with the immigration rules for certain groups like PRUCOL. Those are slated to be fixed this year. Very excited that we believe that Cal Here's will be ready next Monday, May 16th, to determine Health for All Kids eligibility. That's been a big priority for the department and certainly for the advocacy community as well as the legislature. So we're thrilled. Again, Ms. Haspel can talk about how that testing went this morning, but it looks like that should be good to go by next week. We still think there's important work to be done on notices, still not exactly a model of clarity. We have appreciated being at the table with the department. I would say in general, though, in terms of the policy discussions that Ms. Malo described and the larger group that's making the policy decisions, advocates have not been at that table on most things. I did get to go to one pre-JED session, very exciting. But I think the one comment we would make is that still sometimes the policy decisions are being made ahead of time, and then we're asked to tinker around the edges, and there are some significant problems. So we look forward to continuing to work with the department, with Covered California, with Cal Here's, and with CWGA to make sure that the Affordable Care Act is truly working for Californians. Thank you.
Thank you.
Good afternoon. Jessica Haspel with Children Now. I want to echo what my colleague Ms. Landsberg has said about my thanks to the department and CalHERS for working with advocates. Since we were here last year, I do think we have seen progress, and we certainly appreciate the opportunity to have participated in the user acceptance testing. However, as Ms. Landsberg alluded to, there are still remaining defects that relate to issues that we brought to the legislature over a year ago. On the former foster youth front, we have seen the fixes made so that a former foster youth applying online does get a correct eligibility determination. However, the functionality to allow youth to skip irrelevant questions on the application, which make it quite burdensome, did not take effect for former foster youth with non-applying family members. What that means is if a former foster youth has a spouse or a child who doesn't need coverage, the mere fact that there's a household member makes them answer a whole slew of questions about their income, their tax status, etc., even though none of that information affects their eligibility in any regard. And that is a fix that was originally supposed to take place last October, got pushed off till February, and then was determined to be a defect in February, was supposed to then be fixed with 16.4, and we learned on Friday that that was not going to be the case. So it's just a concern that it's a lingering issue that keeps getting continued in terms of its scheduling. Additionally, I wanted to flag a few other defects that are with regard to the messaging. Again, while we really appreciate that youth now get a correct eligibility determination, there's incorrect messaging that tells them when they complete the application that they're required to provide proof of their former foster youth status, even though that's something that should be checked ex parte and is not required. These are defects that were identified in January and that still need to be resolved. So again, I really appreciate that especially want to give a shout out to the DHCS program staff that we've worked with. They have been communicating where things are at, and we really appreciate the partnership, but we are very concerned that some of these defects are still not fixed, and we're not sure when they will be because they have been, the dates we've been given have been continued several times. Thank you.
Thank you.
Thank you, Mr. Chair. Frank Mecca, Executive Director of the County Welfare Directors Association. I want to thank you and this committee, actually, for the amount of time that you've dedicated to the oversight of the considerable issues and concerns that we've had, our members have had, and the workers in our agencies and clients have had with difficulties with the CalHERS system. And since last year, a lot of progress has been made, and we definitely thank the department and OSI for working very closely with us to address many of those. Many things have happened. The prior witnesses have discussed the improvements that have made. Many are still to be employed, and in the meantime, there still continues to be a considerable amount of manual work for our workers to address the ongoing problems that exist in the CalHERS system. On the plus side, we're very happy to see that SB 1341 is moving forward. The state was able to fix a problem where the CalHERS system couldn't take a negative action. We couldn't deny or discontinue someone who's no longer eligible. Those are really important improvements. The income problems that Ms. Landsberg indicated and the fact that clients can continue to submit multiple applications creates a significant amount of work that continues for our workers. So a lot of work still to do. With respect to the 24-month roadmap, I appreciate the analysis with respect to your committee analysis, with respect to concerns about the lack of detail about the 24-month roadmap for 2017. We're very pleased to see that the release dates have, I think it was last week, the release dates came out. Now we have to drill deeper into the 2017 roadmap to deal with sort of the what. We know the when. We have to really drill into the what, because from the county end, we have to make sure that our systems, the SAW systems that interface with CalHERS, the highly successful SAW systems, I'd also point out, and that our staff are prepared so that when the fixes are rolled out at the state level, we can smoothly roll those out at the county level as well.
Thank you.
Good afternoon, Chair Tia Orr from the Service Employees International Union. I would like to defer my testimony to a couple of our eligibility workers we have here, but just to put things in context, I know that we've been working with the department very closely as well as OSI very closely, and we have made a ton of progress. I think one of the major things that you hear our workers speak to that is missing and that we still have to dig into is the lack of the exposure of the MAGI rules. Assemblymember, we spoke to you several times about it and others about this several times. The inability for workers to see why decisions are being made and the budget of why decisions are being made literally creates additional workload and demands on the counties and the clients that need services that is extreme. Our workers can explain to you how this affects their day-to-day operation. I would say from SEIU standpoint, this still stands to be the #1 priority for our eligibility workforce, as well as a 24-month roadmap that I think we've made some progress on. So I'll defer the rest of my comments to our witnesses.
Thank you.
Good afternoon. Thank you for listening today. My name is Edalie Aguilar. I live and work in LA County. This is my 10th year as an eligibility worker serving the public. And while I've seen a lot of improvements with the IT issues, we're often seeing so many delays in regards to the IT issue. We run the system and we see pending, and we don't know why. Because the MAGI, it's just not clear. We don't know what's wrong. So we check everything. We check income. We check, did they have a double application? Did they do everything we could possibly check on our end? And if we still see nothing, there's nothing I can do. Give you an example. On Friday, I had a woman call me at 4:30 in the afternoon. And she says, I'm pregnant. I'm due next week. I've been waiting 8.5 months for you to give me.
How many months did you say?
She's been waiting 8.5 months to get her Medi-Cal approved. And she's still in a pending situation. And she says to me, every month you guys fix it, because we can fix it, right? We go in through meds and we do a workaround, we fix it, we give her eligibility. But every month it'll go back to, after those 30 days, it'll go back to either a share of cost or she's not eligible. And so she was concerned because it was end of the month and then beginning of the month, this month, and she's like, am I going to be able to have my baby and be covered? And I am sitting there on the phone for 3:30, 4 o'clock in the afternoon, and I don't know what to say because I really don't know the answer. I have to create a ticket, which creates work, on the district office, where the lines are out the door from what I understand. The lines are, they're a block around the corner, people waiting to come in. So I'm asking for the clients that we love to serve, for my people in LA County, for my own community. I'm asking to please expose the MAGI rules to us so that we can do our job. Thank you.
Thank you.
Good afternoon. My name is Adolfo Granados. I'm an eligibility worker for the Department of Public Social Services. I've been there for 17 years, and I want to thank you for your time. I'm the one that does the meds. I'm the meds liaison, and the tickets that she's talking about, I'm the one that handles those tickets. Before the ACA came, I was doing maybe 20 tickets per month, and now we're over 2,000 a month. The system, I guess the interface, the e-hit that it's calling, it's not happening. We're doing a disservice to our community because we have the same people coming in every month that aren't getting their dialysis, they're not getting their medicine, and I go on the system, I fix the system, and it's good for this month, but what happens is next month, that when the system updates, now the same people are coming in every month. So like they say, our workers, we have the cases that are pending. We still have to go on the system and give them the aid that they need. And it's just kind of sad that our community is suffering for what's going on here. So I need your help to expose the MAGI rules so we can make it easier for us and our communities. And I want to thank you for your time.
Thank you.
All right.
Good afternoon, Mr. Chair and members. Joshua Golka with the American Federation of State, County, and Municipal Employees. We too appreciate your continued look into the issues that are plaguing the system. Our members, our eligibility workers at the local level are facing many of the same issues that you just heard about, so I won't repeat them, but we look forward to working with you on this issue as we move forward. Thanks.
Thank you. Any other public comment? Seeing none, I want to turn back to our panelists, Ms. Johnson, Ms. Marlowe, if you could just briefly respond to some of the concerns that were heard about the former foster youth issues, income problems, multiple applications, 2,000 tickets per month, MAGI rules. If you want to sort of just weave your statement and address all of those we'd appreciate your overview.
So thank you. So in terms of some of the defects that were identified, so the issues with former foster care, so those things are identified, and we'll be working on identifying a release date for when those things can be fixed. I don't have what that specific date will be, but I do know that that information was brought to my attention by my program staff. So we are working with the project team in terms of identifying when that date will be that we can get that fixed. And we'll certainly make sure that we get that communicated to Ms. Haspel and the other interested stakeholders. In terms of the issues around the multiple applications, we do have a fix that is coming in release 16.4 to help with the duplicate applications. That was something that had been identified to us as a huge issue in terms of the county workload. So we have 2 phases of that fix. So the first part is not going to eliminate the duplicate applications, but it will significantly reduce that. And that solution was arrived at based upon discussions that we were having with folks and looking at the lowest common denominator and changes that we could implement in as timely of a manner as possible.
And I just didn't understand. You said the timeline for that fix. You said the date. I didn't understand.
Oh, I'm sorry. It's in release what we call 16.4, which is going to be
I assumed that was a date, and I thought we already passed
May
that date.
16th.
Got
May
it.
16th.
16.4.
It was 16.4, but we got it pushed back by 2 weeks.
I see. Got
So
it.
it's going to be deployed on May the 16th.
Got
the
it.
same day with
Thank you.
when we release the functionality for SB 75.
Okay.
Apologize for
That's
that.
okay. I just thought, hey, 416 means something else to me.
I don't-
But I thought maybe that meant something different in the department.
It meant something to all of us, too, at one point.
Oh,
but
gotcha.
so-
Please proceed.
And then in terms of the discussions on SB 1341, both in terms of some changes that we're going to have to be making relative to notices, but also more importantly in terms of looking at the issues that have been raised regarding the Magi business rules exposure. That is something that we are working with our colleagues, with CWDA, with the department, with Cover California on, because we do recognize the importance of that. So that is something that has been identified as an initiative for 2017, and meetings are going to be taking place to start having those discussions about what changes are actually needed to effectuate those changes to make that information available to our county eligibility workers.
There was a reference to 2,000 tickets per month, up from, I believe, 20 per month. May not have gotten the interval right, but it sounded like a lot. I was definitely struck by the example of the soon-to-be mom who's been waiting 8.5 months, and just worried that if administrative things get in the way of determining eligibility, then what kind of care will that soon-to-be mom be getting to ensure a healthy pregnancy for her and her child? Can you speak to what we're doing to get these issues fixed so that we won't hear those kinds of examples here?
So, part of that is having a better understanding of what's happening, like, say, with the pending case. That would be something we'd have to delve deeper into. We'd work with the counties to figure out what is going on with that particular case. Hearing the discussion today, it would be something we'd have to delve further into. But part of it is trying to better understand for that particular case what is going on. For pending cases.
Is that typical for someone to wait that long?
That is not typical.
That seems like a pretty long time.
No, that is not typical.
I would give up if I had to wait that long.
Yeah, no, we would hope that they would not give up, especially being that it is an individual who is pregnant. So we would need to further investigate to see for that particular case what is going on. We do get cases that are brought to our attention in terms of some of the challenges that they may be having, and we work very closely with our county partners in terms of trying to do a deeper dive to see what's going on, to see if that is a particular system issue, whether it's something that is occurring within CalHERS, if it's something with the county eligibility system, if it's something with meds. We explore all of those venues to see what that issue is, and then to also identify if there is a fix that's on the horizon, to the extent it is something that is occurring within one of those 3 systems that we can have some control over.
I'm going to ask that you have someone from your office do that deep dive and report to my office to let me know what the outcome
Yes,
of that
I would have to
particular.
follow up and get the particular details.
He looks like he's more than willing to
Yeah,
work with
and-
you to provide those
Yes.
details.
Yes, yes.
I don't need to know the individual's
Oh, yeah.
personal information. I just need to know
Exactly.
what are the
Yes.
circumstances that are
Exactly.
causing it to be that long, and to know that we've gotten it resolved.
Exactly.
Thank you.
Exactly. And then in terms of the 20 tickets versus the 2,000 tickets, I don't know. I'm going to look at and call a friend in terms of my IT colleague, just to see if there's anything to add in terms of the meds issues, other than us kind of going back and doing a deeper dive to see what's been going on. LA County is a large county. We have meds tickets. I'm not here to say if 20 is the right number, because we hear there may be differences. But again, we do recognize that with CalHERS, and with just, the volume of changes we've had to make, and with some of those changes requiring some workarounds, there may be the incident tickets that are lodged. We have to then determine, is it something that's on the med side versus CalHERS versus if it's the county eligibility system. So we have to take all of that into context.
You referenced CalHERS. That's our next issue. I took that as a good segue to move on to CalHERS. Let me say thank you to our panelists on issue 4. Thank you very much to all of our panelists and speakers. We're going to move to CalHERS, and I want to be balanced, and I want to acknowledge that many of the speakers, Ms. Marlowe referenced where there has been improvement, and so I want to commend the improvement and just say let's keep working until we get these outstanding issues resolved.
That's our goal. Thank you.
Thank you. We welcome Ms. Marlowe to continue for the CalHERS budget change proposal. We welcome James Duckins from the Office of Systems Integration. We'll hear from Finance, LEO, and public comment. We are ready whenever you are.
I think Mr. Duckins is going to take this.
Welcome.
Hi, I'm James Duckins. I'm the CalHERS Project Director. I am employee currently of Cover California. And the proposal that you have before you is to move the, let me start with this. So the CalHERS Project has been up since October of 2013, and it's had 3 successful open enrollments periods. The project was brought up under positions under Cover California, and at this time it's feel like it's appropriate now to move those positions over to the Office of Systems Integration, OSI, and this proposal is to move the technology positions from Cover California over to OSI into their portfolio. So we're proposing to move 58 positions from Cover California to OSI, and it's just a matter of transferring positions over. The cost is still paid by the sponsors, so that will not change. The sponsors being Cover California and Department of Healthcare Services.
Thank you. Ms. Marlowe, did you have anything to add?
No, I did not. Thank you.
Thank you. Anything from Finance, from the LEO's office? Any public comment?
Thank you, Mr. Chair. CWD is in support of the BCP.
Thank you.
Elizabeth Landsberg, Western Center on Law and Poverty, also in support of moving the positions over to OSI. Thank you.
Thank you. Any other public comment? Seeing none, we will thank our panelists for your testimony here. We'll move on to issue number 6, EWIC Management Information System and Electronic Benefit Transfer Budget Change Proposals. We welcome Curtis Knapp from the Office of Systems Integration, Connie Mitchell from the Center for Family Health of the Department of Public Health, and Christine Nelson, Chief of Women, Infant, and Children Division, Center for Family and Health from the Department of Public Health. Welcome. We're ready whenever you are.
Okay, great. Thank you. Good afternoon. I'm Christine Nelson. As you said, I'm Chief of the WIC program, the WIC Division in Public Health. And I'll give first an overview about what the project is, and then OSI can give some more specific details. In order to implement EBT for WIC, we must first replace our information system. Our legacy system has been in place for about 20 years. We use it at the state office and in the 600-plus local agency clinics. They use it for enrollment, case management of the WIC families, and also issuing the benefits, so printing the checks currently right now and keeping track of what food packages each family will receive. We are fully funded by the U.S. Department of Agriculture, so the USDA will fund all components of this project. USDA treats EBT implementation as separate from the IT system replacement, so we also talk about it in terms of two components to the project, and in our documents we will separate the costs so that, because we have to report it that way to the USDA as well, so that's why you'll see two different pieces in our budget. An important point here is that to replace our IT system, we are not building a new system, but rather we will use a system that is already functional in another state that USDA has approved for use to transfer to a different state. USDA has approved a handful of systems that are already used in various states, and then there are multiple companies that will be able to bring those systems to California and make some adjustments for California to be able to handle our capacity, our large caseload, and then roll it out with to the state and the local agencies, prepare all the local agency staff, train them for the rollout. So both the system and the company that brings it to California are very important. And we have partnered with Office of Systems Integration to oversee that project to replace the IT system, to hire the company to bring it in, select which system we use, and then the supporting contracts that go along with that. So Public Health will provide funding to Office of Systems Integration, and then OSI has a companion BCP for the staff to go along with that. In addition, Public Health has also partnered with OSI for the EBT service provider contract. So that's not an IT system, but rather more of the banking transactions, the banking service that happens at the grocery store point of sale, so that when a WIC family swipes their card, the device there at the cash register can check to see do they really have that in their balance, and also it handles all the banking part to pay the grocery store for their piece. So Public Health has included those costs in our BCP, but OSI is already doing that work with CalFresh and CalWorks, so they don't have a companion BCP for that piece of Public Health's larger project.
Hi, Curtis Knapp, Deputy Director with the Office of Systems Integration. My division is the Benefit and Enrollment Technology Support, and much about what we talked about this afternoon is my division includes the 3 consortia systems that do eligibility determination, interfaces with CalHERS, and additionally now we're partnering with Department of Public Health to take on project management and services for the development and acquisitions of this replacement for the MIS system. The good news is we've been processing transactions with CalWorks and CalFresh benefits for more than a decade. In fact, we're close to exceeding the $100 billion issued in benefits. So about 4 years ago, we developed a relationship with Department of Public Health. We did some consulting and some mentoring with them prior to them deciding, and in our earlier discussions, we talked what Member Thurman, we talked about what we could do from not being in siloed, what could we do to leverage or be leveraged is what we call leverage or be leveraged opportunities. So from a horizontal perspective, horizontal integration perspective, from an interoperability, this is the first time we'll be partnering with a sister department because we do a lot of work already with Department of Social Services. So we'll have one contract that does benefit issuance and transaction processing for both Department of Social Services and now Public Health. We are now going into our 3rd contract after 12 years, so we've got a lot of experience and we have been successful in that line of work. What we are pleased about in terms of, I'll take this, our BCP specifically asks for $4.1 million, 19.5 positions. Some of the earlier discussion today is about how can we be successful? What's the criteria? What things do we need to do right? And the opportunity is in the pre-planning to make sure you've got a good planning and that you're appropriately resourced. And we recognize resources are always hard to come by. So we're leveraging some existing resources that we already have on the EBT project, and that's how we came up with the 19.5 position. The other really positive thing is we are looking to acquire a system that's already operational out there. But I want to make clear from an expectation perspective, California is always different. And we're looking at things like mobile technology, advanced analytics, NOAAs, most states only do NOAAs and so forth in 2 languages, so there'll be some additional work that we need to do. But the core functionality that allows
NOAAs.
notices of action.
Thank you.
Go to our clients. My apologies. So we're
when we go 4 hours straight with no lunch break and you say NOAAs, I'm thinking something different. So I want to make sure I'm following you, sir. Thank you.
So the investment that we're making up front is going to pay dividends because what is different than previous is we're going from a manual process to an automated process, which is very exciting. When you see folks in the grocery line, in the grocery stores with these vouchers or these food vouchers, if you will. So now the stigma of them getting away from being able to swipe those cards just as if it was a debit card is an awesome opportunity for California to fulfill.
Thank you. Anything from finance, from LAO? This is very helpful. I had just a related question. It's not about EWIC, and I think I asked this once before, and it was about we heard a proposal that would help in areas where there isn't water and would use a system similar to EWIC or EBT to help in communities where there's no access to water. And there were some technological issues that got in the way of being able to do that. And hearing what you've mapped out to make this work with EWIC, I just wanted to know if, as you say, working with sister agencies, there's a way to share the same technology to make sure that we can make sure that people who are without water can get water. Could either of you speak to that?
In the WIC program, we don't authorize water right now, but that same question just came up Thursday or Friday at our Senate hearing, and there was a response from the audience about some work that CalFresh may be doing with that, so we're following up on that.
Anything about the technology that you're using with the EWIC program that would lend itself to that similar effort?
Our chief deputy director is back there, and he can assure you that you had talked earlier about strategically what are we doing. Agency does have a strategic plan, and a couple of things that happen now. Anytime there's an opportunity or somebody's bringing forward and are looking for technology to help resolve a business issue, we look out there what's available. There is nationally, they have tried to do what's called a multi-wallet, where you have lots of different programs on a card. They have not been fully successful for numerous different reasons, but we always are looking for those opportunities, and within our department, we're always looking for opportunities to expand the functionality of payment cards.
If I didn't love public service so much, I'd be creating these new technologies just to address these programs. But I love public service, so here I am. Thank you. Any public comment?
This is Karen Farley with the California WIC Association. We're in support of this, and I wanted to note that the WIC program has been taking input from the local agencies and the grocers for a number of years, and all that information is appreciated, and those efforts are appreciated to make a good MIS system and a good EBT system. It's a complex project, and they've been very thoughtful.
Thank you. Any other public comment? This is a great innovation. Thank you very much. Thank you. Issue number 7, Medi-Cal Dental Fiscal Intermediary Turnover Takeover, SLF. Ms. Marlowe will be joining us. We'll have finance, the LEO's office, and public comment.
Hello, Indiana.
You're our star witness today, Ms. Marlowe.
Love it. So in terms of this request, so we're requesting expenditure authority for 3 years for approximately $2 million in both general fund and federal fund to support the equivalent of 7 3-year limited term positions and for contractual services to address the workload that's going to be associated with the conversion of the current Denti-Cal contract that is currently held by Delta Dental. We're currently in a procurement phase, and we're looking to secure 2 contracts. One contract would be specifically for purposes of paying claims for dental services, and this again would be through our fee-for-service Denti-Cal program. And then the other contract would be used for the actual review and authorization of dental services under the Medi-Cal program. And the second contract, which what we're calling as an administrative services organization contract. That contract would also have the responsibility for the provider relations and beneficiary outreach services that are currently all housed under the one contract of Delta Dental. So Delta Dental today does both the payment of claims on behalf of the department as well as beneficiary services for outreach purposes and outreach purposes for our providers that participate in the program. So based upon requirements that we had to meet from the federal government, the contracts and the services are being split out into the two. So these staff are necessary to help ensure the successful turnover and takeover from the current contract to the two new contractors who are being procured. We're in an active procurement, and we're looking to have an announcement on the successors of the two contracts that we are procuring sometime this month.
So are there, with this changeover, will there be any provisions that Delta Dental will be managing?
It depends upon who the successful contractors are.
So Delta can reapply, is that what you're saying?
Yes, Delta could have reapplied. And I don't know who applied, and I don't know how many applications we did receive. But during the turnover takeover process, Delta will still be in place for a certain time period until the two new contractors take over and then start doing their work. So there's a process for that to occur until the new contractors will get their operations stood up. And during that time that they're standing up their new operations, Delta would be in like a year process of doing that turnover.
During transition?
The transition.
But they're still eligible to apply?
Yes.
Now, I know that we've been talking a lot about outreach and not enough outcome, if you will, in areas, particularly in rural areas. Was any of this decision around the decision to do a re-procurement, as you all say here, based on performance issues or performance concerns?
No, it was more about just the contract having been with the one contractor for the past 23 years and the federal government wanting to ensure that we had appropriate competition and that we were getting the best price for our respective dollars in terms of the funding of this contract.
Were you in any violation by having the same vendor for that many years consecutively without it being rebid?
No, we did rebid it. Over time, it was rebid. The last time it was rebid was back in 2004. Delta was the successful contractor. We then had a subsequent procurement that occurred back in 2011. Delta was the successful contractor. However, during the time period of executing a brand new contract, the federal government would not approve that contract because they felt that there was not enough competition. They were the only bidder at the time for that contract. So they wanted to see us going in a different direction. And then there were also plans by the department. Earlier, you had heard testimony on the CAMUS system. Part of our strategic visioning with the CAMUS system, because it is a fiscal intermediary, meaning they pay our medical claims, we were also looking to fold in some of that functionality from what is done today on the dental side into the CAMUS system.
Are there multiple contractors that could provide at this scale, or is Delta the only one that really could provide at this scale?
At the way the contract was laid out in terms of some of the requirements, Delta was the one contractor that met that requirement, and Delta had also developed the claim system that is used. So it's more of a proprietary system versus something that's like a plug and play, so to speak.
No, is that still the case? You said that it was the case that this was the only provider. Is that still the case, that this is the only provider?
Well, I don't know how many applications came in. We'll know that when the award is announced. But there are other bidders that are out there that could do the work that Delta is doing. And they would just be constructed differently.
Would they have to use Delta's system that you were just describing?
They would have to have a claim system. They would have to use that system, yes.
They have to use Delta's claim system, or they could use
Initially starting out, they would. But then if they had their own system, then they could use that system.
And in the award, will there be incentives and penalties for whatever provider is selected should they not meet performance expectations?
Yes.
Very good. Anything from finance? Anything from the LAO's office? Any public comment? Thank you.
Thank you.
This is our final item. We want to thank you all for your attention today and for everyone's participation, all of our presenters, the public, finance, LEO's office, and of course our budget staff and my office staff. We thank you. This meeting is adjourned.